This video lecture addresses pneumonia. Pneumonia is an inflammation of the lung parenchyma as a result of infection. So parenchyma is a fancy medical word for tissue. So the lung tissue is infected and inflamed. So invading microorganisms colonize the alveoli and initiate an inflammatory response. So remember, those alveoli are those little air pockets that basically result in gas exchange in the lungs, where the lungs put oxygen into the bloodstream. So in this situation, infectious debris can fill the alveoli and interfere with ventilation and gas exchange. So there's a really good picture of this in your book at the top of page 623, so I recommend that you look there. The most common causative agent is Streptococcus pneumoniae. So there is community-acquired pneumonia, healthcare-associated pneumonia, and opportunistic pneumonia. Community-acquired pneumonia occurs as a result of exposure to the microorganism somewhere within the community, so the grocery store or the gym, something like that. Hospital-associated or healthcare-associated would be pneumonia that occurred as the result of contracting that infection in a healthcare facility. And then opportunistic pneumonia occurs when the host is in an immune compromised state. And then back to this slide, you don't have to necessarily memorize these, but these are the different microorganisms that would commonly cause like community-acquired pneumonia and healthcare-associated pneumonia, and then opportunistic. So just thought that was interesting. All right, so pneumonia may be infectious or non-infectious. So infectious would be caused by bacteria, viruses, fungi, protozoa, and other microbes. That would mean, infectious, you could spread that to another person. Non-infectious, you wouldn't be able to spread that to another person, and that would be pneumonia that's caused by aspiration of gastric contents. So that's if I were to, accidentally suck some of my own stomach contents, or even like foods that I was eating or something I was drinking down into my lungs, that could cause pneumonia. And you can see why that wouldn't be like pneumonia that I would be spreading. Non-infectious pneumonia can also be caused by inhalation of toxic or irritating substances like chemicals and fumes. So then there are different classifications of pneumonia that I've got listed there. I'm not going to discuss each of these individually in this lecture. There's really good information about each of these in your textbook on pages 623 through 625. I'm going to refer you to there. So page 623 through 625. Okay. You do need to know these important terms. So these are terms that would be associated with pneumonia. Some of them would be complications of pneumonia. So pleuritis would be a local extension of the infection that involves the pleura. The pleura are the membranes that line the lungs. So that would be called pleuritis. It is pretty painful. It's not really considered like an emergent type condition at all. Then there's a pleural effusion, and that is where there's an accumulation of excess fluid in the pleural cavity. A lung abscess is a local area of pus formation and possibly even necrosis within the lung itself. And it's pretty uncommon. It is kind of a big deal for someone to develop a lung abscess. Typically those need to be drained through some kind of invasive or surgical procedure. And then there's an empyema. That is an accumulation of purulent exudae, or a medical term for pus, in the pleural cavity. That would need to be drained by some type of a procedure, invasive procedure, often by something called a thoracentesis. That's where a needle is inserted into the pleural space to remove the fluid accumulation. And then there's pleuritic pain, and that is sharp, localized chest pain that increases with breathing and coughing, and that can be a pretty common sign of pneumonia. So just know pleuritic pain is, if someone has pain that's worse with movement and breathing, then that would indicate that it's very unlikely chest pain caused by a heart condition, right? Because heart pain is constant and it doesn't change at all with movement or breathing. Okay, high risk for pneumonia are infants, young children, and older adults because they have an immature immune system. Anyone with a diminished gag reflex or cough reflex, because they are at an increased risk for aspirating. We talked about aspiration pneumonia, right? Compromised immune system, they'd be at an increased risk for any type of infection, really. If they're in a debilitated or weakened condition, exposure to cigarette smoke, whether they themselves smoke or it's secondhand exposure, that increases the risk for pneumonia. Alcohol or drug abuse, and then clients at higher risk for pneumonia are at a higher risk for adverse outcomes and complications. So they don't really have the reserves to help them through that major infection. So, pneumonia prevention. So it's important to identify vulnerable populations. Early identification of the infecting organism is important so that can be treated properly, right? And then vaccines are also another important factor. The pneumococcal vaccine would be it's specifically the pneumonia vaccine. High-risk clients would be a good candidate for that. So 65 and older would be considered high risk. Chronic conditions such as COPD would be considered high risk. And then immunocompromised clients are high risk. So they would receive a total of 2 doses. They would receive their first dose, and then in 5 years, they would be revaccinated. And then the influenza vaccine is annually. And then kind of a newer development is COVID-19 vaccine. COVID can develop into pneumonia in some clients. So clinical manifestations are listed here. I've got local effects as well as systemic. This will cause a lot of systemic issues as well. And then also see this table 19.3 in your Pearson Volume 1. It has a more comprehensive list of clinical manifestations, as well as some associated therapies for those manifestations. So diagnostic testing, chest x-ray would be done to really identify whether or not the client has suspicion of an infection in their lungs. So terminology that would be noted on a chest x-ray report that would raise concern that this could be pneumonia are things like fluid accumulation, infiltrates, consolidated lung tissue, atelectasis. All of those terms could indicate that there could be an infection. So a CT scan is kind of a more detailed, specific, and also more expensive, unfortunately, radiologic exam that could check for pneumonia. Sputum culture and sensitivity checks for the presence of microorganisms. Talked about those in previous lectures, particularly the infection and inflammation lecture. And then a CBC, we'd be looking for the white blood cell count. An elevated white blood cell count indicates infection. Serology testing, pulse oximetry is appropriate. Oxygen saturation of less than 96% may indicate impaired gas exchange. An arterial blood gas, a PaO2 of less than 75 to 80 millimeters indicates that there's impaired gas exchange. And then a fiber optic bronchoscopy is a scope that would be inserted down a client's trachea and into their lungs to see what may be causing the infection. So certainly patients that come in with pneumonia would not typically get this bronchoscopy unless, the pneumonia is not improving with treatment, or they've got something to indicate there could be a mass or other issue in their lungs, or if they're repeatedly getting pneumonia, then a bronchoscopy would really be a more specialized test. It's pretty invasive, so really it would want to be limited if possible. Pharmacologic therapy, so pneumonia that is caused by bacterial microorganisms, which the most common causative agent is, like I said, Streptococcus pneumoniae. That is a bacteria. So those, bacterial infections would be treated with an antibiotic that would be to eradicate the infection. Penicillin G and amoxicillin are appropriate for the Streptococcus pneumoniae. And then nafacillin and vancomycin would be more commonly treated for Staphylococcus aureus. That's probably the second most common cause of pneumonia. Bronchodilators can improve ventilation and reduce hypoxia for patients with bronchospasm. So that would be albuterol sulfate and theophylline. Those help to open up the airways, the bronchi. Expectorants such as acetylcysteine or mucomyst and guaifenesin, those help reduce mucus viscosity, so they thin the mucus and they help the client to cough up the mucus and get it out of their lungs. And then oxygen therapy is appropriate if the client is hypoxic. You don't have to know all these, but I just thought it was interesting for you to identify that, different microorganisms require different antibiotics to effectively treat those, okay? I would know the two that I mentioned earlier that I specifically put on that previous PowerPoint slide. So non-pharmacologic therapy, so chest physiotherapy, percussion could be done by rhythmically striking or clapping the chest wall with cupped hands. There are also different devices that can be used for percussion, but essentially it helps to break up mucus and to promote, mucus being coughed up out of the lungs. Vibration also facilitates the movement of secretion into larger airways. And it can be combined with percussion. Vibration is performed by repeatedly tensing the arm and hand muscles while maintaining firm but gentle pressure over the affected area with the flat of the hand. There's pictures of this in your book too. And then there's postural drainage, and that's what these images over here really are demonstrating. And that's positioning the client in specific ways to help use gravity to facilitate the removal of secretions from a particular lung segment. Here's something. A very new type of posturing has been identified for patients who have pneumonia as a result of COVID-19. That's called proning. And they will literally have the client lay like this picture right here. And they'll lay on their stomach, and that helps to promote ventilation and oxygenation of this lung tissue up here in the posterior part of their lung. Because if they're always laying on their back, that part of the lung tissue just is all gunky with secretions and it's not oxygenating well. So proning has really been found to effectively help these patients with COVID. And it can be done for patients who are not on a ventilator and also patients who are on a ventilator. So otherwise, nursing implementation. So maintain a patent airway, ensure effective ventilation and oxygenation. So apply oxygen to maintain the oxygen saturation that you want, actually, per provider order, obviously. You want to try to promote a balance between activity and rest. These patients are going to be tired, obviously, as a result of their infection, but you still just don't want them to lay in the bed or sit in the chair and never get up. They still need to get up, at least a few times a day to try. That promotes lung expansion, ventilation, oxygenation. And then education, they need to complete their medications as prescribed. And then the recommendation for the activity with rest as needed. Coughing and deep breathing exercises are really important to try to just expand the lungs and to break up those secretions and cough those secretions out. Adequate fluid intake is important. That will help to thin their mucus and secretions so that they can cough those up. Adequate nutritional intake is important for them to help and fight this infection appropriately. They should avoid exposure to illness, avoid smoking and secondhand smoke. And then you need to talk to them about what concerning signs and symptoms to watch for, and then to, seek medical treatment for those signs and symptoms, and then talk to them about their follow-up appointments and care. So assessing your client frequently is important, especially their airway and breathing. So respiratory assessment is important. Mental status assessment. They can have mental status changes with this, especially older adult clients. Vital signs. Safety. So if they're confused, especially, there might be safety concerns, or if they're weak. And then skin, just assess for perfusion and then potential skin breakdown. And otherwise, that is the end of this presentation. Thank you.